Hi, I'm Rose Stewart. Welcome to my channel, or welcome back if you've been here before. Today I'm going to take you through a guided somatic tracking meditation. This time with a focus on back pain and any sensations you might experience there, whether that's in your lower back, your mid back, or anywhere along the spine. This is actually part of a little series I've been doing on somatic tracking for different parts of the body. I've already done ones for tummy pain and pelvic pain, so if either of those are relevant to you, take a look at the link in the description. And I have more coming, so do subscribe if you'd like to be notified when these land. Somatic tracking is a technique that comes out of the world of mind-body syndrome and neuroplastic pain, and it's been developed by the wonderful Alan Gordon and his team at the Pain Psychology Centre. If you're not yet familiar with mind-body syndrome and neuroplastic pain, I'll link another video in the description that will tell you a little bit more about the syndrome, including the characteristics of people that tend to experience neuroplastic pain and how it can present. But for now, all you really need to do is know that the brain can generate real sensations in the body, including pain. And even with these sensations, we can learn to feel safe again in our bodies. And that's really what somatic tracking is all about. It's not about pushing through pain or trying to make sensations disappear. It's about bringing a gentle, curious attention to what we are feeling in the moment. And in doing so, sending a message to the brain that these sensations are not dangerous. Somatic tracking is a little bit like a body scan, but rather than simply observing the sensations, we are actually bringing messages of safety to the brain and body. Somatic tracking is a really good exercise to do when you have mild to moderate discomfort in the back, whether that's a feeling of tightness, stiffness, pressure, or a heavy, achy quality that back pain sometimes presents. However, you can still benefit from these exercises even if you don't have a lot of discomfort going on right now. Even just a little bit of something or a worry that pain will show up is enough to make this helpful. We'll get going in a moment, but I'll pop in a timestamp so next time you come back, which I highly encourage, you can just jump straight into the exercise and not worry about the introduction. So taking a moment now to find a comfortable position, whether that's sitting, lying on your back, or even lying on your side if that feels better for you right now. And let's begin. This is an exercise to do when you are experiencing discomfort or unsettled sensations in the back. Just taking a moment to get comfortable. And if you need to shift position at any point during the practice, please do so. It's important to remember that the aim of this exercise is to not make the sensations go away. It's to pay attention to them in a curious way and to build feelings of safety. And to start rewiring the brain's neural pathways. It's quite possible that you'll feel better after doing this exercise, but our goal here is to bring mindfulness and acceptance to our experience in this moment. So just beginning now by taking a few slow, deep breaths. Closing your eyes if you wish, and focusing on breathing down into your belly, followed by a slow exhale. Simply breathing into your belly and taking a little longer on the out-breath. And as you do this, you may want to say the word calm or safe to yourself on each out-breath. In this meditation, we are reminding your mind and body that you are safe. Now we are going to gently bring our attention to the less comfortable sensations in the back, anywhere from the lower back, up through the mid-back, or anywhere along the spine that is calling for your attention now. If you notice any tensing up As you move your attention to this area, just take some time to take a few deep breaths. You might also like to imagine, as you breathe in, your breath coming in and around the area of discomfort, just around the outside. And just noticing now where you are feeling the sensation in your body. We are going to begin with just observing it and labeling the sensations with curiosity. Firstly, just noticing if the sensation has a shape, and if so, what is that shape? How about a weight? Is the sensation heavy or light? Is it warm or cool? Just noticing with curiosity. And moving on to labeling now. Noticing where there is discomfort and trying to use neutral language to describe what you are feeling. So a stabbing sensation might become a pulsing. A feeling of stiffness might become stretching or a drawing in. Or a heavy seizing quality that back pain can sometimes bring might simply become heaviness, pressure, or warmth. Just spending a moment here to notice and label. Simply exploring the sensations without trying to change or fix them. You might even find that the sensations shift or move around the back, perhaps travelling from one spot to another, and this is completely normal. In fact, it's often a sign that the pain is neuroplastic. Just follow the sensations gently with your attention. You might find that as you are doing this, your mind wanders, as this is what minds do much of the time, and that's completely okay. But if that does happen, just gently bring the mind back to the body and your breath. Remind yourself now that you are safe and that these sensations and feelings come and go like the tides. You might even like to say to yourself something like, just sensations, or just my nervous system doing its job. Just gently reminding yourself that you don't need to do anything right now. You don't need to brace against the sensation or try to make them go away, because it doesn't matter that they are present. Gently remind yourself that you are safe and that you are okay. Perhaps telling yourself, I am healthy and strong. Or, I am proud of myself for taking time to take care of myself. Bringing your focus back to your breath now, taking a few slow, deep breaths. As you gently come back into the present moment, notice what you can hear, what you can feel supporting your body. Opening your eyes, if they are closed, and noticing what you see around you right now. Welcome back. And that's somatic tracking for back pain. I hope you're feeling a little bit more safe and present after doing that practice. Remember, the more you come back to this practice, the more you are reinforcing those healthy neural pathways. And over time, your brain and body really can start to feel safe again. So I'd encourage you to come back whenever you need to. And also, if you found this helpful, please let me know in the comments. I'd love to hear from you. And if you haven't already, please like and subscribe so you don't miss the next one. Until next time, keep sending yourself messages of safety and take care of yourself.